So, in regards to volleyball injuries, of course, I mentioned before the aspect of jamming the finger and the different things that that can represent. Of course, that can represent a fracture or a dislocation and various things. And of course, a lot of these things are treated on the sidelines, taped up. Of course, my recommendation is to at least get an evaluation by a hand surgeon, at least get an x-ray to just make sure nothing bad is going on. But one of the things I wanted to discuss is what we consider irreducible dislocations, meaning that the joint pops out of place and on the sidelines or otherwise, trainer or even in the emergency room, the doctor tries to pop it back in place and it doesn't go back into place. And so that's a subset of these dislocations because most of the time, simple dislocations are as simple as they sound. You pop the joint back in, you may buddy tape it, immobilize it for a little bit, protect it, and the ligaments heal up just fine. But when it's irreducible, what happens is that sometimes the ligament actually, when it's torn, can flip into the joint. And that's one thing that can happen. You have different tissues that can kind of interpose or come in between the bones. Another thing that can happen is that the tendons themselves, the tendons that move the finger itself, can actually flip into the joint. And so it's kind of like a rubber band. So you pull the joint back into place and it snaps back out of place because there's something kind of in between. So in those cases, which are not as common as the common dislocation, but in those cases, we do have to go to surgery to fix that. And we have to open everything up and then take the tissue out that's blocking the joint and then pop everything back into place. And at that point, it's a simple thing, but of course, it does involve surgery. So that's one of the areas where you can get a simple dislocation turn into something that's complex.